Hello everyone, I'm Dr. Brianna Vesely. I'm the foot and ankle specialist at Orthopedic and Spine Center. Today, we're going to talk about a condition that can be very painful and frustrating for patients. It's called a Haglund's deformity, sometimes referred to as a pump bump. If you ever have pain at the back of your heel where your shoes rub, especially when wearing dress shoes, athletic shoes, or anything with a firm heel cup, you may have experienced symptoms related to a Haglund's deformity. So, what exactly is a Haglund's deformity? A Haglund's deformity is a bony enlargement on the back of your heel bone, or your calcaneus. This prominence sits right where your Achilles tendon inserts into the heel. Because of this, it is also called insertional Achilles tendonitis, meaning inflammation where your Achilles tendon inserts on your heel, also called your calcaneus bone. Over time, the enlarged bone can rub against shoes, irritating the soft tissue around the area. Patients often develop inflammation of the retrocalcaneal bursa, which is a small, fluid-filled sac that normally helps reduce friction between the Achilles tendon and your heel bone. Many patients describe a Haglund's deformity pain as swelling, redness, and tenderness in the back of the heel. Activities such as walking, running, climbing stairs, or even simply wearing closed-back shoes can cause uncomfortable and a lot of pain for patients with this deformity. Any motion that moves your Achilles tendon can also cause pain. This includes dorsiflexing and plantar flexing your foot, which sadly we do all the time. Traditionally, surgical treatment involved a relatively large incision on the back of your heel in order to access the bone spur and remove it. While effective, these procedures often required extensive soft tissue dissection, longer recovery periods, and carried a risk of wound healing complications because the skin around the Achilles tendon has a limited blood supply. Fortunately, advances in foot and ankle surgery have allowed us to treat many of these patients using minimally invasive techniques. Minimally invasive Haglund surgery is performed through very small incisions using specialized instruments and fluoroscopic guidance. The bony prominence can be removed while minimizing the disruption to the surrounding tissues. Using specialized instruments and fluoroscopic guidance, the bony prominence can be carefully removed while minimizing disruption to the surrounding soft tissue structures. One of the major advantages of this minimally invasive approach is the preservation of the Achilles tendon. In many traditional procedures, part of the tendon may need to be detached and repaired. With the minimally invasive surgery, we can often address the deformity while avoiding significant disruption to the tendon itself. Patients are often interested in the benefits of minimally invasive surgery, and there are several. Smaller incisions generally mean less postoperative pain, reduced scarring, lower risk of wound complications, and potentially a faster recovery. Because the soft tissues are preserved, many patients are able to return to comfortable shoe wear and normal activities sooner than a traditional open procedure. Now, not every patient is a candidate for minimally invasive Haglund surgery. A thorough evaluation is important. We typically obtain x-rays and sometimes advanced imaging such as an MRI to assess the size of the deformity and determine whether there is significant degeneration within the Achilles tendon itself. If substantial tendon damage is present, a more extensive procedure may be necessary. Recovery really varies depending on the individual patient and the exact procedure performed. In many cases, patients are able to be protected weight-bearing relatively early. Physical therapy is recommended after surgery to restore flexibility, strength, and function. Most patients notice progressive improvement over several months as inflammation resolves and the tissues heal. One question I hear frequently is whether surgery should be considered right away. The answer is no. I always recommend conservative treatment first for this pathology. This may include shoe modifications such as heel lifts, anti-inflammatory medications, stretching programs, physical therapy, and activity modification. Surgery is typically reserved for patients whose symptoms persist despite appropriate non-operative treatment. The good news is that for carefully selected patients, minimally invasive Haglund surgery can provide excellent pain relief and allow a return to the activities they enjoy with less downtime and fewer wound-related concerns. Thank you for joining me today. I'm Dr. Brianna Vesley, and I hope this discussion helped you better understand Haglund's deformity and the role of minimally invasive treatment options. If you're experiencing persistent heel pain, feel free to come see me at the Orthopedic and Spine Center in Newport News, Virginia.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.